portion of Lifestyles is sponsored by Senior Connection.
And here with some big words and some bigger questions. Gina Downs, what is medication adherence and polypharmacy? Wow.
We'll start with the easy one.
Okay, there's an easy one?
There is.
Okay.
Medication adherence.
Okay.
It's basically following the directions that the doctor gives you for how you take your medication. If they tell you to take it once a day, then take it once a day. We've got some clients that decide to prescribe for themselves and will take it one day and not another day, or take half a pill. And I can absolutely sympathize with that. I totally understand. Usually the reason they're doing it is affordability.
Exactly.
It is an expensive medication, and so they are trying to stretch out that supply. However, there's got to be a reason that the doctor prescribed it at the dosage and frequency that he has. So it is best to follow the instructions on the label or how it's prescribed, not only how frequent you are taking it, but the time of day. The time of day can have a big factor on how effective the medication is, and you want to make sure that you're following all of those directions.
Okay, I'm going to come back to that, but polypharmacy, more than one pharmacy, is that what we're saying?
Not the pharmacy, more than one medication. When you have more than one medication, you are having drug interactions, medication interactions, and the technical term that I know of is called polypharmacy. It's basically
a new word today.
The interactions together. And the more medications you're taking, the more likely you're going to experience polypharmacy. And that can cause dizziness, it can cause fatigue, vertigo, all these different things because they're interacting, and then you're more likely to have an accident because if you are dizzy or faint from those medications and then you fall, now you've got even a bigger problem. And it's not the doctor that understands that, or from my understanding from a pharmacist, the doctor knows how the drugs affect your body. The pharmacist knows how the drugs affect each other.
How they interact, right.
How they interact, yes. So the question is, ask the pharmacist if your medications are interacting together. Because if you get a good team together between your doctor and your pharmacist, they can help find the right combination of medicines that's, one, going to be effective for your conditions, and two, minimize the interactions that they're having together.
And that's why they call it practicing medicine.
Yes, it is a practice. It is not perfect.
Well, what happens if this becomes a problem, if somebody is not using the medicine as you described for any number of reasons? How does that come into play in the work you do?
Well, it can affect how frequently, how the cost of their medications.
Okay.
And if they're not taking the medications correctly and it's causing other issues, then they could be hospitalized. They could end up in rehab because they've had an accident. So not taking the medication as designed is not only going to have an effect on your pocketbook to the possible savings, but it could have an effect on your life and your pocketbook because you are now more medically ill because of that.
Well, and again, I think to your point, ask your pharmacist because, first of all, when you get prescription medicine, you don't always know what to do with it, and you don't know to ask questions when that is prescribed at that moment.
Correct.
So your pharmacist is a good touchstone.
Exactly. And ask everybody questions. If the doctor prescribes you a medication, ask them why. We have so many clients that our average client list on drugs is over 10 medications.
Right.
And most people have no idea why they're taking a medication, and they just take it. Ask questions. Do not be afraid to ask questions so you understand what's happening and why you're taking this medication.
So important. Ask questions. Thank you, Gina.
Absolutely.
I'm enlightened.
Good.
I've learned a new word. It's word power. We'll be back with more Lifestyles right after this.
This portion of Lifestyles is sponsored by Senior Connection.